Safety and first aid. In this lesson, what is first aid? Fire safety. Burns. First aid for fractures. First aid for sprains. First aid for animal bites. First aid for nose bleeding. First aid for cuts and scratches. Poisoning. You accidentally spilled some hair oil while getting ready for school and forgot to clean it up. What could be the result? Accidents can happen at any place and at any time without warning. They mostly happen due to our carelessness. At times, they can cause serious injuries. We must therefore be prepared to give first aid to the injured person. What is first aid? Treatment given to an injured person immediately after an accident before the arrival of a doctor is called first aid. First aid can prevent the condition of the victim from becoming worse and can even save the life of an injured person. As responsible citizens, it is our duty to learn safety rules and steps to be taken in an emergency. Each one of us should know the basic first aid procedures. Fire safety. Fire can be caused due to many reasons. It may be caused due to electrical faults, leakage of gas in the kitchen, or while cooking food in the kitchen. How to prevent fire? Be careful while handling fire. Electric wiring and electrical appliances must be periodically checked for any damage. Electric wires must be properly insulated. Do not wear synthetic or nylon clothes while cooking food or burning crackers as they catch fire quickly. Children and adults should be careful when lighting firecrackers. Matchsticks should be kept out of reach of children. In case of gas leak, open the windows. Do not light a matchstick or switch on the lights. Do not operate any electrical appliance. A burning matchstick must be put out completely before throwing it away. Sari catching fire. Burn crackers carefully. Putting out fire. In case of a major fire, the fire station must be informed immediately. Small fires can be put out with fire extinguishers. Always keep a fire extinguisher handy in the house, car and office. In case the fire has been caused by electric short circuit, use soil or sand to put out the fire. Do not use water, as it may cause electrocution. Turn off the main switch immediately. In case the fire has been caused by petrol, cut off the supply of air by throwing soil or sand on it. Do not use water, as petrol will float over water and flames will shoot up. In case a person's clothes catch fire, do not allow the person to run around. Cover him/her with a blanket, rug or overcoat to put out the fire. Roll him/her on the floor. If your own clothes catch fire, lie down at once. Roll yourself in a blanket, rug or carpet to put out the fire. Leave the head uncovered. Burns. Burns can be caused by touching hot objects like pans and saucepans, boiling water or milk, steam, burning crackers, chemicals like acid or even by an open flame. Minor burns. Minor burns can be treated at home. Hold the burnt area under running water for some time. Antiseptic cream, lotion or a paste of baking soda and water may be applied to provide relief from the burning sensation. Paste of baking soda can be prepared by adding 1 teaspoonful of baking soda to 1 teaspoonful of water. Soak a piece of cotton in this solution and apply over the burnt area. Severe burns. Make the patient lie down. Make the patient lie down. Cover the burnt area with a clean piece of cloth to prevent germs and dust from entering the wound. Keep the patient's head a little lower than the rest of the body. Do not prick the blisters formed on the skin. This may lead to infection. Give plenty of liquid to drink to the patient, if he/she is conscious and can swallow. Do not give liquid to an unconscious person. Dip a piece of sterile cloth in a solution of baking soda and use it as a wet compress. Send for the doctor immediately. Chemical burns. Remove clothing from the affected area. Wash the area immediately with plenty of water to wash off the chemical. Cover the burnt area with a clean piece of cloth. Follow the rest of the treatment as for burns. First aid for fractures. When a bone breaks or cracks, it is called a fracture. In a fracture, the fractured area may swell up. There is a severe pain. First aid in fracture, leg. First aid in fracture, arm. Treatment. Do not move the fractured part. As far as possible, avoid moving the patient. Tie any available articles such as rolled sheets of newspaper, a magazine, a piece of cardboard or wood, or a pillow around the fractured part. This will act as a splint and prevent the movement of the fractured part. If the bones of the arm are broken, the injured arm should be supported by a sling made of cloth. Take the patient to the doctor immediately. First aid for sprains. When the tissues around a joint get torn, it is called a sprain. It is very painful and may cause swelling and sometimes discoloration of the skin. Apply ice pack on the sprained joint to reduce swelling. Wrap a crepe bandage around the joint to support it. First aid for animal bites. A snake injects poison with its sharp fangs, causing a lot of pain and swelling. When a poisonous snake bites a person, he/she must be attended immediately. Snake's poison travels very quickly through the blood, nervous system and the heart get affected and death may occur. Apply a tight bandage just above 6 inches to 1 foot, the bite to stop the flow of blood to the heart. This will slow down the spread of poison in the body. Apply an ice pack over the bite. Wash the wound with potassium permanganate. Rush the victim to the hospital immediately. Many mammals may carry the rabies virus in their saliva, which may cause hydrophobia, fear of water, a fatal and untreatable disease. Dogs, bats, wolves and cats are known to carry the rabies virus. Wash the wound with soap and water to remove germs. Then apply an antiseptic cream on the wound to prevent infection. Cover it with a sterile gauze. Take the patient to the doctor immediately. First aid for nose bleeding. Nose bleeding is very common among young children, especially during the summer months. Ask the patient to sit down comfortably with the head slightly bent forward. Place a wet handkerchief or preferably an ice pack on the head and nose of the patient. Ask the patient to breathe through the mouth instead of the nose for some time. Contact a doctor in case the bleeding does not stop. First aid for cuts and scratches. Never overlook any injury, howsoever minor it may be. Infections can be caused by germs when they enter the body through open cuts and scratches. Always wash your hands before giving first aid, as germs from dirty hands may infect the wound. Clean the dirt around the wound using running water. Use a cotton wool soaked in antiseptic lotion to clean the affected area thoroughly. Put a pad of cotton wool or sterile gauze on the wound, and press it with your thumb and fingers. This will stop bleeding in most cases. If bleeding continues, a tourniquet bandage can be tightly tied over the wound to stop the flow of blood. Wrap a sterile gauze bandage around the wound. Tetanus, a dangerous disease, may be caused by germs. It is safer to get an anti-tetanus injection administered by a doctor. Making and tying a tourniquet. Bandaging wounds. Poisoning. A number of household things may be poisonous. Things like nail paint, wall and wood paints, detergents, naphthalene balls, and some medicines can be poisonous if swallowed. Remember to keep all medicines under lock and key, away from the reach of little children. Read the label carefully before taking any medicine. All medicines that have crossed their expiry dates must be disposed of. Always wash fruit and vegetables properly before consuming them. Traces of harmful insecticides and pesticides may still be present on them. The patient should be made to vomit if he/she has ingested any poisonous thing. Consult a doctor immediately. Always keep the telephone numbers of your nearest doctor, hospital, chemist, fire station and police station handy. They will help you get advice and assistance immediately in case of an emergency. Be alert and prepared at all times. You will be able to avoid accidents and handle emergencies in a better way.